as long as I can remember, I've been passionate about medicine and healthcare and how neuroscience can transform lives. But as I've learned more about healthcare, one thing has stood out to me. Access to healthcare isn't equal. Too often we think of healthcare as something only medical professionals handle, but the truth is, it's about the people who need it. And right now, there are way too many barriers stopping people from getting the care they deserve. That's why I believe youth can take a role and make the society more inclusive and proactive. So, what are these barriers? These barriers include geographic, financial, social, and cultural. Geographic barriers can mean that they live in a rural area where healthcare or basic care isn't even provided to them. Imagine living in a place where your nearest psychiatrist is 4 to 5 hours away. What happens then? Many go without help. Financial barriers can mean debating between paying medical bills or paying rent. Now, we all know how that feels, right? But then some people actually have distress due to this. And then social barriers can mean leading into stigma. So the idea that living in a tight-knit community, but only one mental health clinic, but then you might just avoid going to that health clinic because you don't want to be seen there. Cultural barriers can mean that you have this idea of not using healthcare or you not going to the hospital for it, but instead of handling it with inner strength or a prayer. And then there's awareness, or the lack of it. Many people today don't even realize they need help until said by somebody or known by oneself. The Adverse Childhood Experience Questionnaire helps assess how early trauma affects people in early on lives. But how many of us here have heard of it? Can I get a raise of hands? Not that many. So without this awareness, we can't even begin to break these barriers. Over 1 in 5 million people in the US alone face this, and yet nobody talks about it. But here's the good news. Youth can take a lead in this. We can do something about it. Youth are stepping up in big ways in this society right now. Take, for example, the Synapse Project. This project was taken from brain science and complex brain math and broken down into common brain science for other people to understand. This let people know that mental health was a key part in their lives, and that nobody should be taken into account for not having the care they need. And this helps people understand that mental health was important for them. For me, as an Indian classical Bharatanatyam dancer, mental health has been a huge part of my life. For me, I've grown up with Bharatanatyam, and since the age of 4, wellness and health and keeping it stable was a big part of my life. The idea of taking care of my body was a huge part. And the people around me, finding community, building perspectives, was also a big part. So whether it's through policy or even the arts, we can change the world by just asking somebody and by having own connections with ourselves. So one key way to change is through storytelling. Think about it. When somebody shares a story about an overlooked disease, it brings attention to something that was never heard of. Imagine a child going through school, but then faces immense depression or immense stress. But then they hear somebody their age talk openly about therapy. That can be the one push they need for them to seek help. This changed perspectives, builds empathy, and finds connection between other people. Over 5 million people in this world don't have the opportunity or the courage to share their stories. This is not good because people now need the chance to share their stories, and we as youth need to let them know that they're not alone in this. So, what does the future look like if youth takes the lead? Well, imagine a system where healthcare isn't limited by wealth or location, but it's designed with accessibility in mind. Imagine a system where the youth doesn't just play a key role as students or patients, but as key people in medical advancements. This isn't just wishful thinking, it's already happening. Youth are stepping up in big ways right now. As said before with the Synapse Project, we can do something about it. We can start destigmatizing the world right now by just having conversations, educating ourselves, turning around to the people you talk and say, hey, how are you feeling today? We can change. The theme of this event is Stories Beyond Boundaries. And I believe that breaking boundaries starts with breaking the mental barriers that tell us we can't make a difference. So, whether you're interested in policy, arts, or simply just care about people, to ask yourself, what can I do to help make healthcare better? Because the future of healthcare isn't in the hands of doctors alone, it's in all of ours. Thank you for your time and thank you for the opportunity.